The mission of Allergy and Asthma Network is to end the needless death and suffering due to allergies, asthma, and related conditions like eczema or COPD or COVID. We do this through our 4 mission areas: outreach, education, advocacy, and research. As the CEO of the network, it's my privilege to lead the team, the staff, the team, the volunteers, everyone who works together to accomplish that mission on a daily basis. So as the CEO, I'm the national spokesperson. I do a lot of the media outlets and certainly engage with our patient community as well as our healthcare provider community. I have the opportunity to represent the network at professional congresses, about 10 to 20 of those a year. And I also have the opportunity to work with the staff on a daily basis to make sure that all of the resources and programs that we're putting forth meet the unmet needs in the community.
We're always looking for innovative ways to make our programming really accessible to people. So we're really these days undergoing a digital transformation. So with that innovation, we want to be able to give patients the information they want and need right where they are in real time. I look carefully at where our gaps are in programming or what publications might be needed. We really want to make sure that we're updating our information constantly. We update that about every 6 months, every time there's a need with a new medication. And we have a lot of publications that we're constantly updating, and we're coming up with new things all the time.
More and more people are going online for health information, and so what we want to do is kind of examine everything we're doing and then see if there's a better way we can reach them, whether it's through our website or social media platforms or other kinds of online engagement.
As the Director of Advocacy, I help fulfill that mission by helping to shape public policy on behalf of those individuals with these chronic conditions. Biggest initiatives that me, myself, and those who work with me under the advocacy mission area are, working to provide access to care, affordable medications and treatments, working on environmental health issues, health equity issues, and bringing forth even increased access to telemedicine, particularly in the light of just where we are today dealing with, COVID.
We believe that all patients have rights and that all patients should have equal access to health care. And so we do this through all of our mission areas, but especially our advocacy mission area, where we are working together to educate and influence public policy and payer policy to ensure that every person living with allergy, asthma, and related conditions gets the care they need.
We make sure our patients' voice is heard, and in working with our partners and leaders in national research, we have our patients that are advisors, so they're on an advisory board, and they share their insights then on all the stages of clinical research development. They're not just subjects. That's the main important thing that I think about in research, is that we get past the fact that patients are subjects that we're prodding and poking on to find out what's going on. We also conduct surveys with healthcare providers and patients and their families to gain more understanding about what their quality of life is like, about their disease management, also their access to care, which is a big issue. And there's lots of other interesting things that we learn about our patients through this type of research.
So we often say that it first takes an engaged patient to become an educated patient to then become an empowered patient. And the truth is, we're not all patients, we're people, right? And we want to be educated and empowered in our own lives and in our healthcare. And so that's why it's so important, the work we do at the network. Because whether it is engaging patients through outreach, educating them through our programs and services, or advocating and empowering them through our advocacy efforts and research, it's all to advance that individual ability to advocate for themselves, but then also collectively for the community.